Sandra Adams. I'm a nursing student at Columbus State University, and I'm here today to teach culturally competent care for the nurse. I'm here with two co-workers. I'm going to present this. How to deliver culturally competent care. What does it mean to be culturally competent to a nurse? The definition: nurses must be able to provide competent care by incorporating a patient's cultural beliefs and practices into the plan of care. The goal of nursing practice is to help patients regain their independence and return to their optimal level of health, or to die with dignity at the end of life. Nurses help the patient attain optimal health by treating each person as an individual, taking into account that person's cultural and spiritual experiences. What is culture? Culture is a system of symbols that is shared, learned, and passed on through generations of social group. Culture mediates between human beings and chaos. It influences what people perceive and guides people's interactions with each other. It is a process rather than a static entity, and it changes over time. How do you become culturally competent? Become interested and ask questions. Research and find out about other cultures. Ask your patients, families that you are different from, co-workers or other hospital employees. Culturally competent with the Hispanic population. Now, originally I believed Hispanic meant to cover any Spanish-speaking person, but that's not actually true. The Hispanic population speaks Spanish and follows the traditions of Spain. The Latino family, or Latino culture, is from Latin America, which includes Brazil and Haiti, but does not necessarily speak Spanish. And then Mexican are from Mexico and do speak Spanish. Many people use the term Mexican to describe all Spanish-speaking people. This is just not the case. Norms in the Mexican culture and healthcare. When you have that Mexican patient, it is very important to recognize that they have verbal and nonverbal communications. For Mexican usually are characterized by respect, and communications to Mexicans should also be very respectful. There is an element of formality in Mexican interactions, especially with older persons, when older persons are involved. Over-familiarity, physical touch by strangers, or verbal or casual use of first names is really not appreciated in early relationships. It is uncommon for Mexicans to be aggressive or assertive in healthcare interactions. Direct eye contact is less common also among the Mexicans than their Anglo counterparts. Direct disagreement with a provider is also uncommon. The usual response to a decision with which the patient or the family disagrees is silence and noncompliance. A brisk healthcare provider may the provider may first not learn of significant complaints from the patient, and two, find that the patient is very unlikely to return to seek care. Despite the lack of public complaint, Mexicans tend to have an acute sense of justice and often perceive failures in communication to be due to prejudice. They just feel like you're prejudiced against them if you don't communicate with them like you should. Communications in the relationship between the patient and healthcare provider are key to providing quality care. Trust and interpersonal comfort is a critical component of the relationship between the person who is ill and the healer or care provider. In large part, it is the relational aspect of care that places folk healers in a place of importance among Mexicans living in the U.S. The quality of care, as seen here, is not just having the correct diagnosis and treatment, but also the way in which the treatment is provided. So if you have a patient that is from Mexico and you're not very friendly or very respectful saying Mr. or Mrs., and you don't just walk in the room and touch them or start doing your assessment. It takes time, and you have to introduce yourself, and always be respectful and kind, and not too assertive or aggressive. When you receive that new patient that is Mexican, do the following. Get an interpreter of the same gender. This will go a long way. Don't use family to interpret at all if possible. Be kind, gentle, and patient. Shake hands before you touch them. Explain what you're doing or going to do. Be respectful, using Mr. or Mrs. Say yes ma'am or no ma'am, yes sir or no sir. Give written instructions in their language. Most hospitals have educational material that is translated into Spanish. And the other thing with the Mexican population is that they have a belief of hot and cold, much like the Asians have the yin and yang. They believe in hot disease process and cold disease process, and they may not tell you that, but that is part of their belief. And I believe it's important to include that in their health care and their process of getting better and feeling better and feeling respected. And that concludes my PowerPoint on culturally competent. Thank you.